Hello, everyone. We will just get started in about 43 seconds. We're going to let people have a moment to jump on. Thank you for being here. People are still coming in. We are going to get started in just about 16 seconds. All right, folks are still jumping in, but we're going to go ahead and get started because we're going to need the entire hour today. Good afternoon and welcome to the Indiana Youth Institute's webinar on the state of the child for youth in Indiana. My name is Joshua Long. I'm the Senior Educational Content Manager at the Indiana Youth Institute, and we are so glad that you've joined us for today's presentation. And we are grateful to have the chance to connect as a community of Indiana youth workers that remain committed to meeting the needs of our youth and children. Taylor, if you could go to the next slide. Thank you. For those that are not familiar with IYI, our mission is to improve the lives of all Indiana children by strengthening and connecting the people, organizations, and communities that are focused on kids and youth. Listed here, you can see the values that drive the work we do for youth in Indiana. And before we begin, I'm just going to share a few pointers that will help you engage with today's webinar. For any technical support issues, use the chat feature to send a message, and Aaron Whitcomb, IYI's registration manager, is behind the scenes to assist you. You can also use this feature to converse with the group as well. So if you have a moment, feel free to introduce yourself, share who you work with, and anything else you'd like to share. Additionally, you'll be able to download a copy of today's PowerPoint, I think from the chat, but for sure, it'll be sent out after. We also encourage you to ask questions, so please use the Q&A feature for any you may have, and we'll get to as many as possible. And then you can also, within the Q&A function, upvote great questions to the top so that if you have the same question, we know how many people want that answered. Later today, you will receive an email with a link to complete an evaluation of this webinar. Please take a few minutes to let us know your thoughts on today's presentation. And if you don't receive the evaluation email, check your junk email as it may have been directed there. Once you complete the evaluation, you will be redirected to your certificate of participation. So just to restate that, we do give certificates for attending this webinar, but you have to fill out the evaluation to get it. Like all of IYI's webinars, today's webinar will be posted on our website if you'd like to revisit a portion later or share the opportunity to listen with partners. It is now my pleasure to introduce our speakers, Bree Yown and Taylor Johnson of the Indiana Youth Institute. To improve the lives of all Indiana children, Indiana Youth Institute provides access to reliable data and resources to empower, educate, and equip those who impact youth. Our annual data book provides the best and most recent information on child well-being so that leaders, policymakers, youth workers, and advocates have a go-to source for critical data to create positive change for youth. We look forward to today's presentation, and so I'm going to turn it over to Bree and Taylor.
Thanks so much, Josh. Really appreciate it. As Josh said, my name is Taylor Johnson, and I'm the Policy and Data Advocacy Manager here at the Indiana Youth Institute. And as Josh touched on, Indiana Youth Institute exists to improve the lives of all Indiana children. And the way we achieve that mission is by strengthening the work that you all do, our youth workers throughout the state, and connecting with all of you, the people, the organizations, and communities that focus on the work on our state's kids. IYI's vision continues to be a catalyst in increasing the well-being of our kids, advancing the services and the policies that you all spark and enact that translate into tangible benefits for children and youth. One of the most well-known ways that we approach our work is through data collection, analysis, and communication. We're driven by the understanding that Indiana can and should be a great place to grow up. It was for many of us. I'm not sure how many of you grew up in the state of Indiana. I'm sure a good chunk. And it is for many of our kids. And at the same time, we understand that the reality today, it is not yet a place where all children are safe, well-educated, financially stable, and healthy. And the future success of our state depends on our ability and your ability to ensure that all children have the chance to be successful. in the year 2023, we have a ton of data available, and we're going to go through just a brief amount of it here this afternoon. Please take advantage of our data book and our county dashboards, which we'll touch on, but there is a lot of data that is available and out there. And with all that data, it can be difficult to know how to attain it and where to find it and really interpret it and really use it to impact and assess the programs that you all are implementing that impact our children. And the Kids Count data book aims to pull all of that data, massive amounts of data, and make it easy for you to access and put into action. The State of the Child was launched 6 years ago as a way to spark data-informed discussion and action. And we strive to make Indiana a great place to be a kid. We've already talked about, we know that it can be. The data shows us those opportunities to think deeper, to collaborate with one another and members of your communities, to break down silos and barriers, and opportunities to do more. To best serve our Hoosier kids, we need to first start with who they are, who comprises kids in the state of Indiana. Indiana is home to the 14th largest population of children nationally, with more than 1.59 million children younger than the age of 18. Indiana's child population is actually far more diverse than our adult population. Approximately 35%, more than 1 in 3 children in Indiana is a race or ethnicity other than white, compared to 25% of adults 18 and older. Among Indiana's largest race and ethnic groups, the largest shifts over the decade that we've seen in residents who identify as either multi-race, which increased, or white, which has decreased. As children make up 23.6% of our population and 100% of our future leaders and workers, it's important that we're looking for ways and opportunities to better support their growth and their well-being. And today we're going to highlight how Indiana is doing in areas of family and community, health, economic well-being, and education. And you see on the screen here our overall child well-being as put forward by the Annie Casey Foundation is 28th. Family and community is tied for 31st in the nation, and economic and well-being 19th, and education 17th. In our in-person State of the Child this morning at the State House, Dr. Silverman made a great point that a lot of times we view these numbers as Indiana being in the middle of the pack. And while it's kind of true, is 31st and 28th out of 50 states really middle of the pack? And the truth is, it's not. We are falling slightly behind in these areas. Those are the same rankings. You see kind of how each individual domains have trended over the past couple of years since 2017. I'll call your attention to health, and we're going to spend some time talking about that this afternoon, where health historically has been our lowest ranking indicator. And now, to dive a little bit deeper into the data, I'd like to turn it over to my friend and colleague, Bree Yoon.
Let me slide on in here. Okay, so hi everyone, I'm Bree Yoon. I am the Data and Research Manager here at IYI, and I am so excited to speak to you all. As Taylor mentioned, Indiana's family and community domain ranks 31st. As you can see on the screen, these are the 4 indicators that Annie Casey Foundation uses to weigh that ranking respectfully. That being said, as you all have seen today, or hopefully will see soon, our data book tracks well over 100 additional data indicators, a few of which we're going to walk you through right now. Okay, there's been a steady decline in the number of children in foster care, open CHINS cases, and total removals. After the federal government passed the Family First Prevention Services Act in 2018, DCS developed a prevention plan that utilizes intensive family preservation services. These services include mental health treatment, substance abuse treatment and prevention, and parenting programs. Additionally, DCS and the Indiana General Assembly made several legislative and policy changes that are aimed at addressing immediate needs, such as creating an exception to the statutory definition of neglect for parents who are faced with financial barriers, also updating caseload standards to align with the national recommendations, just to name a few. All right, let's dive in. Let's dive in a little bit further, right? So since 2018, the number of children in foster care decreased by 40%, over 13,600 Hoosier children. In the last year alone, Indiana saw a 12.5% decrease of children in foster care. What does that look like on a county level? Well, 3/4 of our 92 counties saw a decrease in the last year, and 2/3 of our counties decreased more than the state average of 12.5%. Right. The number of open CHINS cases decreased by 45% since 2018. Nearly 5,500 Hoosier children. Within the last year, Indiana saw a 17.6% decrease. 2/3 of our counties had a decrease in the number of new CHINS cases opened, and half of our counties decreased more than the state average of 17.6%. Since 2018, the total number of children removed from their home decreased by 43%, nearly 4,500 children. And if you're a March Madness fan, woohoo, nearly 2 times the total college basketball players playing in both the men's and the women's NCAA tournament this year. Indiana saw a 16.1% decrease in the total removals within the last year. Breaking that down on a county level, again, 2/3 of our counties reported a decrease in total removals. The little less than half decreased more than the state average of 16.1%. Okay, it's clear improvements have been made, yet we still see a gap among marginalized populations. Children who are Black or multiracial are overrepresented among Indiana's foster care youth. While Black children make up about 10% of Indiana's child population as a whole, they represent nearly 16% of the foster care population. Similarly, multiracial children comprise of nearly 13% of youth in foster care, yet make up only 7% of the total child population. By utilizing federal resources and support, we've seen increased opportunities for family preservation and reduced instances in which a child must be removed from the home. Our work in progress in this area as a state is certainly cause for acknowledgement, but we cannot become complacent in our efforts. Research shows that children succeed when they're reunited with their families, but only if the families have access and sufficient services and help that enables them to become better parents. As we continue to work towards our goal of maintaining family structures and allowing children to remain in their home, we must also work towards ensuring that children and family have access to necessary supports and technology within the household. All right, no surprise, right? COVID redefined the way that we work and engage with the outside world. It also opened opportunity for students learning to expand while they're away from school. This transition has highlighted the importance of making technology accessible and available to our students. Research shows children lacking access to technology and internet will fall behind their peers. While the number of students that did not have access to a computer or internet subscription decreased overall in 2021, India still falls behind the nationwide average across every single grade level. School corporations have worked hard to address these heightened technology access gaps with creative and innovative solutions, ranging from community partnerships, mobile Wi-Fi hotspots, and even relying on public resources like the local library. However, this places increased pressure on school corporations to maintain these efforts. The need for more permanent, adequate internet access is necessary and vital to collaboration, advancement opportunities, and expanding learning outside of the classroom walls. Perhaps among the greatest examples of the importance of technology in today's society is the role it serves in providing access to necessary healthcare. Telehealth has been and will continue to be an avenue to expand much needed healthcare services to children and young adults throughout the state.
Well, as Bree just mentioned, technology plays a crucial role in telehealth care. Using available technology to expand healthcare into our underserved areas is an important first step in ensuring that all Hoosier children are healthy and cared for, thus improving some of the rankings that you see on the screen right now. Expanding healthcare access through services like telehealth is perhaps more important than ever. In primary care, mental health care, and dental care, we see that many of our counties, and as a result, much of our state population, are underserved in all of these areas. The ratio of health providers to population throughout the state confirms that Hoosiers are experiencing a shortage in accessing necessary healthcare. And again, all three areas of care, we fall behind the national average of provider ratios. Now, it's important to note that the data on your screen right now is not child specific, but it does show, and it's an indicator of the care that children have access to within their own communities. These ratios show that not only are Indiana families facing barriers in accessing healthcare, but that our healthcare professionals, our doctors, our nurses, our clinicians, our frontline healthcare workers are overwhelmed by the demand that they're facing. Whether it's specialty care or a specific concern or preventative care and routine visits that are so crucial to the development and health of our children in the state should have sufficient access and robust care as they grow up. For parents and children living in these underserved communities, the unfortunate result is often foregoing care altogether. Of parents surveyed from 2020 to 2021, half of those who had to forego care for their child attributed the reason to not being able to simply get an appointment. 36% of parents indicated that cost was the primary factor in deciding not to receive or pursue care, suggesting that even if they had access to care where they lived, they simply could not afford it. While not every child in Indiana currently has access to the medical care they need for a variety of reasons, I think all of us agree that our schools should always be places of support and safe haven for children to receive not just education, but the necessary care. Yet, as these ratios once again show, as a state, we currently do not meet any of the recommended ratios for student support services, like counselors, social workers, school psychologists, and even school nurses. These ratios show that children in Indiana schools especially do not have access to social workers and psychologists who can provide valuable resources to process and cope with problems that many of our students face. Throughout the state, we have 4.5 times more students per psychologist than the recommended ratio and 11 times more students per social workers when compared to the recommended ratios. If children in Indiana families do not have access to care within their communities and also face substantial barriers when they seek out those services at school, what effect must that have on their overall well-being and how they view the importance of their own health? Unfortunately, the healthcare needs and the shortages we see today do not stop at the physical health of children, but it also extends deeply into the mental health as well. The prevalence of mental health issues among Indiana residents has been on the rise in recent years. The data shows in staggering fashion that adults and children alike are experiencing more pronounced mental health challenges. In recognition of this concerning and growing trend, the Indiana Behavioral Health Commission produced a comprehensive report that serves not only to identify problems in this area, but provide targeted and strategic recommendations to address the mental health issues that we are seeing today. The data surrounding the mental health issues our children are facing shows the need for such work and the continuation of that work in this area. From 2020 to 2021, 45.5% of children in Indiana with a mental health or a behavioral condition did not receive treatment. And 3.5% of our youth were receiving treatment for mental health. But in the data that I'm about to show you next, we know that that number could be much higher if they had access to sufficient care. As we've already touched on, students often rely on staff within their schools to provide additional care and resources. This remains true as schools and staff work to address the mental health of our children. In 2020, at the top of the blue line, you see 86.3% of our schools had a lead health education teacher that had received professional development on emotional and mental health within the last 2 years. And this is a statistic that should be championed and celebrated because it shows that many of our schools have the necessary resources available to address the mental health challenges that our students are facing. Immediately below that line, you see a yellow line that shows the percentage of schools in which teachers tried to increase efforts and student knowledge on suicide prevention. 62% of Indiana schools found it necessary and important to increase efforts and knowledge surrounding suicide prevention. And in typical data analytics fashion, the question then should be asked, what caused our schools in the state of Indiana to increase suicide prevention curriculum nearly 3 times over in just 6 years? Mental health issues and poor mental health in general is not a population-specific problem. Every child, regardless of race, ethnicity, gender, or income, can and may experience a variety of mental health issues. However, the data does show that certain groups, particularly our Black, Hispanic, and multiracial students, have poorer mental health compared to that of their peers. The yellow bars show the percentage of students among each disaggregated group who reported that their mental health was most of the time or always not good within the past 30 days at the time of the survey was administered. The blue bars show the percentage of students who felt sad or hopeless every day for 2 or more weeks. And this is the clinical definition of depression. The percentage of students who experienced depression within a year of the survey administration was over 50% for our Hispanic, multicultural, and other race students. More than half of the students in these groups experienced persistent sadness and hopelessness for at least 2 weeks. Instead of being filled with optimism and hope and wonder that should always be prevalent in our children's lives. All of us know that these statistics are not simply numbers on a slide or percentages in a report. They represent our kids, our students, the communities that we serve. For many of these children, especially those who are unable to find the care and the help they need, the answer to their mental health problems in their mind is suicide. We see the outcomes of untreated mental health in these grim data points surrounding suicide ideation. 27.7% of high school students in Indiana seriously contemplated taking their own life in 2022. 27.7%. Just a few percentage points shy of a third of high school students in Indiana considered suicide in 2022. 22.2% of high school students actively made a plan on how they would attempt to commit their suicide. That's just over 1 of every 5 students in Indiana who actively made a plan on how they would attempt suicide. And 11.8% of our students actually attempted to take their own life. 11.8% of high schoolers with futures, families, promise, and value attempted to kill themselves in 2022. Just as we saw the disparities arise in the prevalence of mental health issues, similar disparities present themselves in the suicide ideation numbers. Particularly of note are our multiracial students who seriously considered suicide, doubling the suicide ideation of the next closest racial groups. We also see that youth suicide ideation is not just a passing phase unique to one age group, but instead it extends across all grade levels. For each grade, from 9th through 12th, over a quarter of students seriously considered attempting suicide, and over 20% in each grade made a plan on how they would attempt suicide. I've already highlighted the ethnic and racial disparities we see when it comes to mental health and suicide ideation. And yet there is another still population that the data shows is even more marginalized when it comes to these topics. And that's our LGBTQ population. Across the board, from poor mental health to depression to attempting suicide, LGBTQ students more than double the rates compared to heterosexual students. In Indiana, 80% of gay, lesbian, and bisexual students experienced depression in 2021. 65% considered attempting suicide. And if you thought the 11.8% was alarming, when we talked about the totality of high school students, 22.5% of our LGBTQ population actually attempted to end their life. These are wide and deeply concerning gaps. It's clear that many of our students in Indiana are experiencing declined mental health, suicidal thoughts. That data is clear. The data is also clear that students who are Black, Hispanic, multiracial, students who belong to the LGBTQ community are experiencing these issues at much higher rates. The physical and mental health of Hoosier children is dependent on our continued recognition of the opportunities that exist, and if addressed, will improve the well-being of children throughout the state. Children and families in Indiana today are struggling to find sufficient and affordable health care, often totally foregoing necessary medical visits because they are unable to even get an appointment. As I mentioned at the very top, we are at the very beginning of this presentation. Our health ranking is our lowest performing domain and has historically been so. The data that we just went over paints a bleak but sharp picture. Children and families do not have access to health care, and they are suffering from poor mental health and untreated mental health conditions. This far too often results in a cost that can't be counted or shouldn't be counted in an economic terms, but it's counted through the loss of a child's possibilities, their future, and their life. If our children are unable to receive the care they need to live healthy lives, or not able to obtain the help that is necessary to face these mental health challenges, as shown by the data, how can they focus on their own educational opportunities? If so much of their time and energy is spent worrying about how to cope with the stress that they're encountering or trying to determine where to turn to for help, much less of their attention then is being spent dedicated to plotting out their course and future life, dreaming of their future, and learning foundational concepts that position our kids for success. Here we see again some of the core indicators that NEKC Foundation tracks within the education domain. And while we did see some slight improvement in these rankings in 2019, this data was pulled prior to COVID. The differences in proficiency between pre-COVID testing and post-COVID testing are dramatic. From 2019 to 2022, we see a 5.7 drop in iRead proficiency by students throughout the state. iLearn presents a similar decline. Both English language arts and math proficiency hovered around 48% in 2019, but declined by 6.7 and 8.4% respectively in 2022. These declines represent students throughout the state. So in order for us to get a better picture, a better grasp on which students are meeting proficiency standards and which ones are struggling, we need to once again look at this data broken out by subgroup. This time series bar chart shows the percentage of iRead proficiency that specific populations achieved in 2019, 2021, and 2022. Now, obviously, you'll see a year missing there, and that would be 2020. And that's because these assessments were not administered during that year. Much like the data we saw in the health section, we saw a disproportionate and elevated decline in proficiency among our Black, Hispanic, multiracial, and Native Hawaiian or Pacific Islander students. Gauging iLearn English language arts proficiency, the data shows that already low percentages were made lower in 2021 and in 2022, specifically, again, among our Black, Hispanic, multiracial, and Native Hawaiian or Pacific Islander populations. In 2022, only 19% of Indiana's Black students demonstrated proficiency in iLearn English language arts, which is down from just 25% in 2019. Within iLearn math testing, we see yet again low proficiency scores made lower in 2022 across all populations, but exhibited to a greater degree within our racially diverse students. Hispanic students saw a decline of nearly 10% in math proficiency, and Native Hawaiian or Pacific Islander students saw a 17% drop in math proficiency. These iLearn and iRead scores suggest that many of our students are struggling to demonstrate proficiency and mastery of concepts like English language arts and math, starting as early as 3rd grade and continuing on into 8th grade. Indiana schools are also simultaneously seeing a decline in our high school graduation rate and an incline in our statewide dropout rate. In fact, both have reached their respective low points and high points when compared to the past 10 years of data. In 2022, our statewide graduation rate hit 86.6%. And in raw numbers, this translates to 1 out of every students in Indiana not graduating in 2022. If our students aren't sufficiently grasping concepts at a high school level, and significant numbers are unable to meet graduation requirements, how can we expect them then to be adequately prepared for post-secondary ready life? When it comes to college enrollment, the favorite data adage rings true. Correlation does not always equal causation. We cannot directly link the decline in high school graduation and the incline in dropout rates to the decline in college enrollment throughout the state. However, there are certainly parallels that exist between these two data points. Total college enrollment declined to 53.4% in 2022, and many of the specific subpopulations you see listed were at or below 50% enrollment, with a handful of notable exceptions. Asian students continue to enroll in college at much higher rates when compared to their peers, as do 21st century scholars. We continue to see a shift in college-going rates among our male and female populations, as females have started to outpace their male counterparts over the past couple of years when it comes to college enrollment. We also see higher college-going rates among those students who earned dual credit in high school. Now, while 21st century scholars continue to enroll in college at a rate of 80.6%, the overall enrollment in the 21st Century Scholars Program has been declining. On the left, you see a heat map of eligible students who completed enrollment in the program from the 2026 cohort. And on the right, just one class later, the same data, but with significant decline from just one prior year. Recent data shows that nearly 40% of Indiana students are eligible for some type of assistance through 21st Century Scholars Program, and yet only half of all eligible students enroll. We see a similar trend in presenting Indiana's FAFSA filing rate. Compared to our neighboring states, our filing rate among students comes in last at 36%. Just over a third of high school seniors graduating this year completed a free application to possibly receive financial aid. Through the decline in 21st century and in FAFSA filing rates, Indiana students are actively leaving money on the table when it comes to continuing their education, whether that's a certificate, a 2-year degree, or a 4-year degree. In an increasingly globalized, complex, and an evolving workforce, it's the hope of nearly every Hoosier that the current and future generation of students are prepared for whatever form the economy takes on next. Every child in Indiana, every child, should be confident in their abilities and encouraged to pursue their aspirations and goals, being assured that the future they dream of is attainable here in Indiana. Recognizing that those goals are different for every child and every person, certainly the foundation of those ambitions should be built up in high school and strengthened. But we know that those ambitions and those aspirations start much earlier than high school. As a state, we have the opportunity to increase our students' preparedness for the future by expanding our investment in their education and continuing the investments that we are already doing as a state. One of the ways we can both expand and continue our investment is in the accessibility and availability of early childhood care and education for all families, regardless of income.
1 in 10 Indiana households with children younger than 6 reported problems with childcare severe enough to have caused someone in the family to quit a job, not take a job, or greatly change their job in the past year. The high demand of care and insufficient supply of available spots has created an environment where too many families are forced to decide between choosing to pay for basic necessities or a quality program for their child. The estimated demand that you can see right here for an early childhood care totals over 337,000 children 5 years younger. In other words, that's the number of Hoosier children in households where all parents are in the workforce. Yet, the total licensed program capacity only meets a little over half of that projected demand. Taking that a step further, of the 4,100 programs, only about 1,600 meet the high quality standards. So how does that translate, right? Well, for every 4 estimated children in need of care, there's only 2 spots available, only one of which is in a high quality program. The Early Learning Access Index, or ELI for short, measures 4 factors: capacity, quality, affordability, and choice. The ELI score is based on a range from lowest of 0 to highest of 100. Indiana's statewide ELI score has improved from 60.6 in 2021 to 62.2 in 2022, yet no counties were deemed to have adequate access. Despite the growing estimate and demand for care, 25 counties actually saw a decline and their overall access score. This one gets me. Indiana is one of 33 states. I'll say it again. Indiana is one of 33 states where infant care is more expensive than college. Let's take a family of 4 for an example. The average family size in Indiana. Now, this family has an infant and a 4-year-old, and the average annual cost of care, center-based care for this family would have been around $22,830, a quarter of the median household income for a married coupled household. Okay, now here's the thing. For a single family or single mother household, which makes up about 20% of the households in Indiana, that equates to 3/4 of the median income. Throughout the pandemic, out-of-school programs both adapted and expanded their services to meet the changing needs of our children and families. While these programs play a vital role in the well-being of our students, too many children are being left out. Indiana has hit an all-time high in demand. For every 1 child enrolled in after-school, 3 more are waiting for a program to become available to them. While parent satisfaction of their child's overall after-school program experience itself was an impressive 97%, parents in Indiana were more likely to report challenges accessing the actual programs. These barriers include, as you see right here, lack of affordability, availability, safe transportation to and from, and unmet scheduling needs. Child Care Aware releases their annual national rankings in terms of affordability, not cost of care. The least affordable states for care have the highest prices relative to their specific median family income for that state. According to the latest report, Indiana came in at 17th for center-based before and after school care, illustrating the price of school-age programs as a percentage of income in Indiana was higher than the majority of the other states. The data shows that early child care and education programs are just as important to the development of the child as they are to the communities throughout the state. The accessibility and availability to these programs within our local communities speaks to the gaps and opportunities that exist. Of course, we cannot evaluate the successes and vulnerabilities of a community based on child care access alone, but accessing the individual factors affecting each community requires a much more comprehensive approach that involves looking at things like socioeconomic status, household makeup, or even a community's access to transportation. And you might see a theme here if you look at the slide. All of these more comprehensive indicators are actually measured by the CDC Social Vulnerability Index, or SVI for short. As you can see here, SVI ranks 16 social factors. The higher the SVI score is, the more socially vulnerable that community is. These 16 factors not only comprise of one overall score, but they're also grouped and ranked within the 4 related themes on the slide. So socioeconomic status encompasses poverty, unemployment, housing cost burden, educational attainment, and health insurance. And then household characteristics is made up of senior and child populations, disability status, single parent households, and English language proficiency. Racial and ethnic minority status, and as it indicates, it measures race and ethnic populations. And then finally, housing type and transportation consists of multi-unit structures, mobile homes, crowding, group quarters, and household vehicles. Okay, so how is SVI typically used? Well, generally speaking, it's used as a tool for emergency response teams and public health officials to identify and support communities before, during, or after a public health emergency. But my friends, there is so much more room for opportunity.
Well, as Bree said, SVI was traditionally created by the CDC as a tool to evaluate where communities stood, so that in the event of a catastrophic event, a disaster, flooding, earthquake, things of that nature, instead of making split-second decisions based on unreliable or kind of circumstantial data, now we have the tool to evaluate which communities are going to need our help first and how we can best serve them. And so that's how it was originally created. So if you look at the top of the slide here, it says opportunity tool. And hopefully one of the themes that you've picked up on throughout this presentation is that we want to highlight and point out the opportunities that exist. Yes, it can be easy to get lost in some of the more saddening elements of the data. But just because they make us feel sad or unaccomplished doesn't mean that opportunity doesn't exist within that data. In fact, more opportunity sometimes exists in the data that makes us feel the worst, right? So as this opportunity tool, we want to make sure that we are providing resources and kind of broadening and expanding our thinking and hopefully your thinking and how you view data to inform your decisions that you're making on a daily basis within your communities. So I want you to take a mental snapshot of the four, from the far left-hand side, the 4 domains that SVI tracks. We have socioeconomic status, household characteristics, racial and ethnic minority, and housing types and transportation. Kind of remember those, keep those at the forefront of your mind. I'm going to switch slides and we'll see how many we think that we compare to something called the social determinants of health. Now, I assume, or I would believe that many of you on this webinar understand, have already heard of what social determinants of health are. For those of you that don't know, social determinants of health are exactly what it says. They are the determinants, the factors that are present within our community and our societies that we live in that impact and affect how healthy our communities are. So when we look at those things that SVI is already measuring and we compare them to the things that social determinants of health are kind of categorized into, I think what we start to see is that they're, for the most part, really one and the same. And so instead of using SVI just as an emergency response tool, and it's a great tool for that, as people and as youth workers within your particular communities, the SVI is a tool that you can use today to identify areas that your community is perhaps doing really well in or is vulnerable in. What investments need to be made? What programs need to be implemented? What do we need to call attention to within our community that kind of falls in those domains of social determinants of health? At IYI, we're always looking for new ways to incorporate data into informing our decision-making and helping you to inform your decision-making. And we think that this overlap of the Social Vulnerability Index and social determinants of health is just a great opportunity to use tools and data that's readily available, both on the CDC and on our dashboard, which we're going to touch on here in a little bit, to use that data to inform the decisions that you all are making within your communities. So on the screen now, you see a QR code. If you do not have a data book link yet, you can scan the QR code. It will also be sent out to you at the end of the webinar in a follow-up email. So if you don't have a chance, you don't have your phone, or maybe you're watching on your phone, rest assured, we are going to send you a link. It'll be on the IYI website. Please go out and dive in. All the data that we just went over and presented will be in there, and tons more. You can find it on the website underneath data and research. It'll be right there. It says Indiana Kids Count Data Book. You click on that and it'll take you right to it. Now I want to spend the last couple of minutes. Bree and I are going to, as we've been kind of weekend updating, sliding in and out across the screen here, we want to spend a couple of minutes talking about something that our team has been working on, especially Bree, in preparing county dashboards. We know how important data is to you all, and state data is great, but a lot of times you really want more specific, granular, focused data as it pertains to the counties and the communities that you live. So we wanted to do county dashboards that are useful, usable, and really easy to use. And I think Bree has done a fantastic job in creating county dashboards, and we are going to kind of run through. So let me share my screen, switch over here.
To build on what Taylor was saying too, what's unique about this year's dashboard is that we will be updating it throughout the year too. So as new data gets released, we will be updating the dashboard to reflect that, to make sure that you have the most timely and relevant information at your hands. And Taylor is going to walk us through this.
Yes, I will play. This is me. So if I screw something up, don't blame Bree. It's me playing with the dashboard.
I have spent a lot of time in this dashboard.
So at the top here, obviously you see kind of the snapshot of what the dashboard is. And down here at the bottom, you see these tabs and these arrows. This is how you can switch between pages on the dashboard. So we have the landing page, kind of explains again what IYI is for new users. Second, we have a really good description on how to use the dashboard. And this is what we're going to get into a little bit today, as well as kind of potentially exploring the data. And then on slide 3, we actually get into our demographics.
Yeah. Hey, Taylor, you want to pick a fun county?
Yes.
any county.
What are we
Any county you're
thinking today?
thinking. I don't know. Which one?
I'm feeling Lawrence.
Okay, perfect. Love it. Awesome. So as you can tell, or maybe you couldn't quite tell, but all of these graphs and actually the dashboard slides after will completely update to reflect Lawrence County. So whatever county you pick, it will automatically update all throughout. Also, hey, Taylor, you want to click that fun little dancing icon? Damn, look at that. Okay, so for the youth demographics, this one specifically, this one is a little different than the next four. It will give you a year and the source for all three parts. Hey, Taylor, you want to switch the
Yes.
Nailed it. Love it. Okay, now you want to click one of those dancing info.
Well, since we were talking about SVI, let's just keep on theme.
Perfect. There you'll find the state average. The year, the year is very important because, as I said earlier, we're going to be updating this throughout the year. So you definitely want to keep an eye on that, specifically the source that we used, and then definition. What's so amazing this year about our dashboard as well as our data book is we've incorporated definitions and significances for my man Taylor over here, for you to really understand and get some background information too on what that specific visual tells us. Hey Taylor, speaking of the SVI visual, you want to pop down on that. So not only can you filter by county, you can also filter by, especially with the heat maps, by, oh, okay. Oh, we're going to skip to that. All right.
Oh, I thought you wanted, okay, sorry.
Okay.
I'm jumping ahead.
The drop down, the drop down of the overall, we have actually all four themes there too for you. So if you're really specific, like you wanted to really just dive into household characteristics, guess what? We have a map for you. You want socioeconomic status? We have a map for that. We have it for you. And we also have the overall as well. But Taylor is just so excited about this sorting legend. I'm going to let him talk about it.
Yeah, so not only if you hover over your county, you can see. So I actually reside in Harrison County. So we see Harrison County has a 0.2198 SVI score, right? Pretty low on the vulnerability index. But if I wanted to know, okay, well, what other counties are low on the index or are comparable to my county, I can go right here, make sure that Harrison's actually highlighted, click on it. And now I see, okay, so Perry and Crawford, those are pretty close. May I want to go back down one. And now I'm starting to see, okay, well, there's actually a lot of counties that are pretty comparable to Harrison County. So not only can you hover over each county and see exactly what their score is, not just for SVI, but for other domains that we'll go into, you can actually filter on the legend here, which I think is really useful when we're trying to get a broader gauge of not only how our counties are doing, but how our regions are doing. I know that's important work as communities that you all are placed in can oftentimes span multiple counties and kind of extend into the region themselves. So it's really a cool way to dive into the region that you are operating in.
Okay, you want to hop over to the next slide? Love it. Similar to this too, something I do want to point out is not all counties, this is just a highlight, not all counties for the support staff to student ratio have all four support staff positions. So not all of them will have a psychologist, social worker, school nurse, and I think the last one is a counselor. Yes, winner. Okay, not all counties will have four. So whatever is the most relevant, or if that county does, it will automatically update. So some counties will only have a school nurse or counselor. It will automatically do that for you. Another thing, if you want to click over to the next one. Love it. If you were wanting to get the ratio between, say, for example, the free reduced price lunch, and you didn't want the price or paid lunch in your visual, you can deselect that little legend. Nailed it. Love it. To get the ratio of free lunch and just reduced price lunch. So there are various ways that you can go and play with this and filtering data. Let's see what else. Oh, hey, Taylor.
Yeah.
I'm really excited about this dashboard, by the way. So I want to share it to all my friends. If you see that little bar on the bottom, the navy blue bar, and if you click the red share button, guess what that does?
Send it out to all the people.
All friends. Yay, awesome. And then if you click on, hey, Taylor, I also want to print off a copy of my my counties to hand it out. You got it. You can actually print, and even up in here, the share, it will give you an option to download. You got it. JPEG, PDF file, you name it. There's so many options, so many beautiful options for you to hand that out. Let's see, anything else? I think it's just so much fun.
Taylor and Bree, can I ask one quick question about the county snapshot that we got?
Yeah.
Is there a way to analyze multiple counties together or in comparison?
That is an extremely great question. So as of right now, no. There will be, and that will be the second rollout. So right now, unfortunately, it's just a singular option as far as county. But my friends, that is coming to you. Stay tuned. It's going to happen. Great question. Thank you for asking. Are there any questions, Josh, that you see about the dashboard itself?
We just got one. Is it live yet?
Yeah, absolutely. Today is launch day. Today is
Yes.
launch day for both the data book and the county snapshots.
Okay,
And
then
those
where?
links- Yeah,
Yeah, go
those
ahead,
links
Taylor.
will be sent out in the follow-up email, but like the data book, if you go to iyy.org under data and research, see a drop down and you will see the county dashboard. And you click on that, it'll take you to a landing page and you will be able to access and enter the dashboard. So the link will be sent out, but it's also available on our website right now.
Great. Is there a way for counties to be broken down into communities or townships, or is it just at the county level?
Currently, no, because we do all of our data that we track is on a county level as of right now, because we go hand in hand with the census data. We do have plans to expand that to even incorporate like school districts. That's another round 2 launch. But yes, it's definitely in our plans. Great questions.
That's all we have for now.
Perfect. One last thing I do want to note, that every single indicator on this dashboard is also lives in our data book. So if you want to know more, if you want to know the significance on why this is so important, if you want to go a little bit diver into see, how Indiana is doing as a whole, it's there for you. Also, it will be moving. So unlike our data book that is static, the dashboard is always getting updated. This is your source for the more relevant and timely data. Yay. How excited are we? Yay. I'm excited.
Let me stop sharing and we will open it up. If there are any additional questions, now would be the time to ask. Either something that we covered specifically in the presentation, a question about the data book, or a question again about county dashboard. We are doing our best, and I think that we are succeeding in making sure that we are providing you, the youth workers that we partner with, that we serve with, the data and the information and tools that you need to keep doing the fantastic and meaningful work every day in kids' lives throughout the state. So we want to make sure that we're serving you. We want to make sure we're equipping you, and hopefully that you can use these tools to, again, continue the fantastic work that I know all of you are doing within your communities.
Hey, Taylor, can I tell you a tip and trick about the data book?
Yes, hit me.
It's my favorite one. Okay, so if there's something that you're interested in that's in the data book itself that we didn't cover, because as we showed you, there's so much, you can actually go to the resources page and click where we got the data itself, and the sky is the limit, my friends. There's so much more in all the sources that we use. I love it.
Yes.
I love it. Perfect. Anything else come in, Josh? Or we?
No, nothing else. What I will say is when the PowerPoint goes out and you've gone through it, if you have questions on it, just feel free to email someone at IYI about those questions and we'll be able to get back to you on those. Other than that, I think we are good on questions. And so Taylor and Bree, if you're ready for me to wrap up, I'd be happy to do so.
Take it away.
Great. As a reminder, a copy of the presentation PowerPoint will be sent to you in the follow-up email, as well as the links to the data book itself. Also, I'd like to just remind you that to receive the latest updates on the data book and other IYI opportunities, please sign up for our newsletter, which is iyyi.org/newsletter. Additionally, we have some really cool events coming up that we would love for you to sign up for. The first one is our Advancing Equity Summit. That's May 2nd and 3rd. That is a virtual summit that is free to attend for Indiana youth workers. You can find that out at iyI.org. Additionally, we have some webinars coming up that folks might be interested in, as well as our Stop Child Abuse and Neglect conference that we host every year virtually, which is April 19th. Again, you can find those at iyI.org/events. And so as we conclude, I just want to thank everyone who joined us today. We had a big crowd and the chat was active. We appreciate that. We appreciate your impact and we value your voice and the choice you made to learn and partner with us. As a reminder, you will receive an email with a link to complete an evaluation of this webinar. Please take a few minutes to let us know what you thought about today's presentation. We really look at evaluations to help us guide the content that we put out to you. So we value that. And additionally, that is the way to get your certificate as well. If you don't receive it, please check your junk email. So with that concludes our presentation. And on behalf of Indiana's youth, thank you again so much for showing up today and every day for Indiana youth.